What's up, beautiful people? Another day, another study. In my experience talking with patients, most people are aware that obesity is a risk factor for cardiovascular disease, diabetes, and some types of cancer. But what I've seen is they're not really aware that obesity is associated with accelerated aging, cognitive decline, and neurodegenerative disorders like dementia. And the mechanism behind this is we see that when you compare people who have elevated obesity markers versus those who don't, there's an increase in chronic low level inflammation, there's oxidative stress, and mitochondrial dysfunction when we look at mechanistic type studies. Other studies have shown obesity is associated with greater brain volume loss in middle aged and older adults compared to younger adults with obesity. A lot of the problems with the previous research was it was looking at one specific time point, and it wasn't when you followed people's trajectories of these obesity markers. So this study sought to answer that question. They looked at obesity marker trajectory, and then they looked at cognitive function and brain structure through imaging and cognitive testing. So, for brain anatomy, compared to the group that did not have elevated markers of obesity that were stable throughout the study period, there was a progressive trend in worsening brain function and structural abnormalities as the groups progressed from decreasing obesity markers, meaning so they had elevated markers, but they were going down during the study period, to increasing markers to those who had moderate, stably high markers to those who had high, stable markers. And those who had high, stable markers had the worst outcomes when they looked at structural abnormalities. Then for cognitive function, they saw pretty much the same, that those with increasing markers, moderately stable, elevated markers, and high stable elevated markers showed diminished cognitive function in reasoning, working memory, and visual motor speed domains when they did the cognitive testing. And when they did the mediation analysis, it revealed that the changes in brain volume and function mediated the changes seen in cognitive testing. What's interesting is the areas of the brain that showed these changes were in areas associated with eating, digestion, nutrient processing, food intake, reward, and sensory processing. So obesity is a disease. It's not a lack of willpower or discipline. It is a disease, and it requires disease management and treatment strategies. So psychosocial, pharmacology, and lifestyle management.